Welcome back, everybody. So back in early August, we had a segment about teens and acne and about how their skin, to get it ready for school, I should say. We had so much response from you at home that we're talking once again about acne this morning, specifically Accutane and other treatments that we can take. And Dr. Seth Forman is back with us this morning, and you became a very popular guest here on this show, immediately so. So we're talking about, took a bunch of calls about Accutane. Explain why you like this stuff.
Well, this is an extremely important medication. I mean, when you absolutely positively have to get rid of your acne, when you want to go to prom, when you want to have a good interview for college,
sure,
when you want to get that job, this is the medication. When you've tried everything else, we don't make many promises in medicine, this is the silver bullet for acne.
But the FDA comes out and says, hey, well, let's hold on, this isn't the best stuff to use. You disagree, you love this stuff.
I disagree, and so does the American Academy of Dermatology disagrees as well. This medication, there are some risks, such as women who are pregnant cannot take this medication.
Right.
People who have a risk or a history of depression or suicide should not take this medication. But really, the only side effects that patients usually have while taking Accutane is severe dryness. I mean, that really is the main problem. Anything that's moist or wet becomes very, very dry. So what I usually have are my teenagers, they're usually carrying around lip balm, like Vaseline lip balm.
Sure.
They're usually carrying around like eye drops, either natural tears or just your regular old-fashioned eye drops. And the thing that I always have my teenagers have is carry around some moisturizer like CeraVe. I mean, this helps restore natural barrier function.
I took this stuff when I was a teen, and I dried out. My brother, it wasn't a severe drying, but my brother took it, and his lips, they got all cracked and all that good stuff. You've seen Wonder.
That's why they need to carry around their
before and
Vaseline.
after pictures, and this is why you like this stuff so much. It does work, you say.
Absolutely. It's not just me, it's the patients. I mean, and the fact that they say there's a risk of depression, it's actually more a risk of being extremely happy and extremely excited about the results.
Do we have those before and after pictures?
Well, here's a great after picture. You can become an anchor.
There we go. Here we go. Go ahead and explain what we're
Well,
seeing.
here we go. Day one. This is our patient who comes in and says, I've tried everything else. What else can you do for me, doctor? And so what you decide to do is you say, well, let's start the Accutane process. There's a lot of paperwork to do at this time where patients do have to use and do have to register online. The other thing that they have to do is agree that they're going to get blood tests every month to monitor their liver enzymes and their cholesterol. But this really is your before and after treatment. Patient all of a sudden is almost completely clear after 12 weeks, and that really is what I tell my patients. You're not going to clear up after, you're on day one, day two, you're not going to be clear. It's really that week 12 where it really kicks in for most patients, and you may never need another acne treatment again.
It's permanent, because once I took the stuff,
60 to 70% of patients who go through one complete course of Accutane never need another acne medicine.
For those who have mild forms, Clearasil, Oxy10, what they're over
mild forms? Those are, there are. I mean, Clearasil, Oxy10, Clean and Clear, those are all great formulations for people with really mild acne. Accutane is not for your mild acne.
Right.
It really is for that moderate acne that's very persistent and hasn't responded to oral antibiotics or hasn't responded to the medications we talked about last time, or the severe acne where someone just walks in and you say, well, we're not even going to try the antibiotics, we're not even going to try the topical medicines, you need Accutane, let's get the paperwork together and let's get you started. All
right, so kids, how young can they be before they start taking this?
Well, I'd say the youngest patient I've ever had on Accutane is probably around 11 or 12.
Really?
Absolutely, because what you want to do is you want to prevent the scarring.
Yeah.
If you have severe inflammatory acne at 11, let's make those teenage years, work for you, and let's not have the scarring.
Anything else that you think viewers should know, specifically kids who are very concerned about this?
The most important thing I would tell children and parents, as well as adults who have acne, is give your dermatologist 6 months with this medication, and it can change your life.
All right. Thanks very much. There you go. That's all you want to know about Accutane. It's not the poison the FDA apparently has made it out, according to you and the Board of Dermatology. Important to know. Thanks very much. Let's head over to Chris.